I'd like to talk to you for a moment about our ambitions for capacity building in the next ARC. Before I do though, I think it's useful for us to reflect on where we've come from. So when the ARC was set up nearly 6 years ago, the career development strategy really committed to these ambitions of having 5 PhD students by year 2, 4 pre-doctoral fellows and up to 10 research interns. And these were for registered health and care professionals. But in response to the needs of the system, we did broaden that out to non-registered staff working across health and care organisations so that capacity could be built where it was needed. And that's where we started, but we've come a long way. And you can see on the left-hand side of that arrow, there were our original programmes, but we've actually vastly expanded the breadth of the programmes that we offer in capacity building. And I'm not going to go through them all now, but many of those were due to a successful applications for funding from NIHR to provide capacity building opportunities in things like social care. We have a huge remit which we'll be sharing with you a bit later about the work that we're doing in social care. We have pre-application support awards. We've currently funded 12 individuals to apply for competitive funding applications, and we also lead in knowledge mobilisation and promote many opportunities for that. So they're just some of them. So we've really increased. And this is really nicely shown by a nice visual metaphor here of a tree that I can't take credit for. The team put that together and it looks fantastic. And this really shows that growth from our early days in 2020 all the way, and you can see at the top there in 2025, we've got multiple programmes, more and more award holders, and in total, we've supported 127 individuals. And you can see also all the many different logos that are represented there, and those are the organisations that we've worked with and have supported their staff to take part in these programmes. And just to reflect on some of the key successes, we've held lots of training events. We've held them within capacity building, but along with our ARC GM themes, such as implementation science. We've worked closely with our public and community involvement engagement team, and there's just a couple of photos from some of those training events. And they've been great opportunities for individuals from across our programmes to get together and share ideas. We've had award holders go on to secure additional funding, so really, making great strides in terms of development, taking on PhD fellowships, pre-doctoral fellowships, and their own project grants, which is great to see. 5 of our alumni in the last 18 months have started their PhDs, funded by NIHR, by the Welcome Forward North scheme and the local NHS trusts. And we have a huge number of PhD students that are supported by the ARC, with 16 of them doing their PhDs with us. And again, highlighting the great work that has been made in terms of social care capacity building, which is a clear area for further development. And I'm not going to steal their thunder because I know they're going to talk more about that later. But we have got this vibrant group of social care professionals working in collaboration with Manchester Met, with the NHS Greater Manchester Adult Social Care Transformation Team, local authorities and care providers, so really working together with across Greater Manchester. But what about the future? Well, our vision in the next ARC is to increase Greater Manchester and the UK's capacity and capability to do excellent, timely research in areas of priority, acting on those research findings and really improving health and care to reduce inequalities. And we're going to do that through four objectives. We want to build on the collaborations that we've already got, promote those further. So building collaborations between ARC GM, our research and practice and research and policy. We want to empower our people. We want to empower people in health and care research to get involved, to take up new opportunities, empower our staff as well to become research leaders. We want to champion research inclusion. We want to increase our diversity across our programmes, have equity of opportunities and provide research inclusion training. And then spread our knowledge, that is spreading knowledge of research, influencing, not just sharing of knowledge, but actually influencing decision making. And this is the research capacity pipeline. So we want to work across that entire pipeline, from early awareness of research, engaging with health and care professionals much earlier in their education to raise awareness of potential careers, have more opportunities and varied opportunities for exposure to research, improve our pre-doctoral development and doctoral programs to improve variety and equity and diversity in those programs, so we're getting to those underrepresented areas and professions, and support those through the postdoctoral phase, and work with our partners to support successful practitioner academics that can straddle research and practice successfully. So ARC2 does present many new opportunities to build capacity across the health and care system and through that pipeline. And we're going to be providing a range of ARC-GM academic career development fellowships that are inclusive and provide that clear pathway to development. And we want to build on our successes in social care, those underrepresented areas such as public health, local authorities, those underrepresented professional areas as well, pharmacy, midwifery being just two of them, and working closely with our less research-intensive NHS organisations. So more details about this will come apparent over the coming months. Please do follow us on LinkedIn and on our website so you can learn about those opportunities.